Hey everybody, welcome back. Today we are talking about everyone's favorite topic in EMS, and that is frequent flyers. How many times have you gone out to the same place, sometimes multiple times in a shift, but at the very least multiple times in a week, in a month, in a year? Well, it's very, very, very easy to hear that address and just be like, oh, God, really? I'm human. I get it. I've been there. I worked at a place where there was one particular patient that called hundreds, plural, hundreds of times a year. I not even intentionally, I got to the point where I had this particular patient's personal information memorized because I had put it in so many times. I just knew it. I didn't have to ask anymore. I would just maybe clarify. It's like, yeah, your last four is this, right? Yeah, okay, cool. You're still allergic to this and this and this? Yeah, okay, cool. All right. Very, very, very easy to get irritated with these calls because what is most often the case? Most often, your frequent callers usually don't have anything wrong with them. Or if they do, it's because they're not taking their meds, they're not doing what they're supposed to be doing, they're not taking care of themselves. And so, even if they are having a medical inconvenience of some kind, it was 100% preventable, which irritates us. Let's face it, it does irritate us. However, unfortunately, referring to the same patient that I just talked about a minute ago, hypothetically, every 100 calls, give or take, every 100 to 200 calls, this patient would actually have a true emergency and like a god awful, like sick as shit crisis. I can't tell you how many times I heard people who missed stuff on that patient because they didn't take it seriously. Frequent flyers are one of the greatest dangers to your career. Not like you're some victim to it, no, but those kinds of calls are a massive danger to your career on several fronts. One, it's an easy way to get enough complaints racked up that you become kind of a pariah. If enough frequent flyers are filing complaints against you, then okay, that can become a problem. But the bigger issue is if you treat them like the boy that cried wolf, which is a natural reaction, well, you're going to miss the time when the wolf is actually there. You're going to miss the actual emergency. So, yeah, it sucks. But you still have to take seriously and dispassionately assess your frequent flyer patients. And a lot of times we use frequent flyers as a justification for bad habits, like not bringing in a cardiac monitor on a chest pain call. And I know that sounds like a no duh thing, but you would not believe the number of times I've seen it. And in some cases, times that I've done it in the past. I'm not sitting here saying that I'm a fucking saint with this. Like there were times in, days gone by where I was no different. And that shit bites you in the ass. It really does. You can't do that. Take these patients seriously. It's not like anything bad is going to happen to you if you over ALS a frequent flyer. Okay, cool. But if you BLS one that you shouldn't have, that's a whole separate problem. So you're better off being taken in by them a little bit than by just having a default posture of, I don't give a shit. Because that's where you make mistakes. And just because you're irritated to be there doesn't mean that you need to let everybody else know that. And again, I'm speaking from personal experience, not lecturing. We get too complacent dealing with frequent flyers, and we get too complacent with how we express our emotions on these kinds of calls. And I know all of the, well, I'm just blunt, I'm just direct, my face doesn't have a filter. Really? We're really gonna act like that? We're gonna talk like that? That's toddlers. I expect better out of my own children. My preteen middle school children, I expect significantly more from them than that. So stop acting like children. A frequent flyer is not going to hurt you. Doing that report is not going to hurt you. You will be fine. I promise. I promise you'll be okay. And I understand the argument people make, well, it's tying up resources. I understand that. I do understand that. However, if we go down the slippery slope of trying to say that we shouldn't go out for certain patients or that they shouldn't be evaluated, we should just deny them transport because we're irritated with them, that's not good either. Yes, I think we should have a better triaging. We should have more tiers to a tiered response. I think there's other options out there than just sending an ambulance to every single call for medical assistance. But at the end of the day, someone calls you, even if you don't believe them, even if there's no clinical information to back that up, you still got to do your job. Be a professional. It's not going to hurt you. It's not going to hurt your career. You're not going to get in trouble for it. You're not going to get sued for it. Oh, I mean, I'm sure somebody could find anything to sue you over, but like the simple act of taking somebody to the hospital that wanted to go is not going to generate a lawsuit just because of that. If it does, there's other factors at play. So just, I don't know how else to say it other than just be a grown-up. Like, is that too much to ask? Can we just be grown-ups about this? Yeah, it's irritating, but it's still a human being. We like to depersonalize. Even the name frequent flyer, we kind of use as in a way. And I'm not saying we do this maliciously, but I think we do it as it's kind of a depersonalizing term. And I think we need to be careful of that because, yes, it's irritating. Yes, it's most likely unnecessary. Most likely, but they're still a human being that deserves to be treated just as well as you do. And if they don't treat you well, then that's a whole different problem. If a patient is being belligerent or threatening or whatever, that's a whole different conversation. But if Mima just wants to go because she wants some peace of mind, even though it's not a big deal or there's actually nothing wrong, don't treat grandma like shit. That's not right. That's not fair. Don't do that. Be better than that. Like, seriously, be better than that. As clinicians, we should be taking every complaint seriously by default. Now, that doesn't mean that you don't make it an objective evaluation of it and say, oh, well, yeah, this is bullshit. Cool. Do that in your head. Have that conversation in your head and still start at the point of taking it seriously. So you walk into a scene, patient has a complaint. You may have seen this patient 5 times in the last week. Listen to the complaint. Do a thorough assessment. Make sure that you've ruled out anything actually legitimate from happening to them. Because here's the thing. Being a frequent flyer doesn't mean that you can't have medical emergencies. Just because you call a lot of times for non-emergent issues doesn't mean that you're exempt from having an emergent issue. So, I don't know how else to say this. Just be a grown-up, talk to your patients, treat them respectfully, be professional. That's it. It's really straightforward. If you do that, if you be a professional, if you treat your patients well, if you thoroughly assess them and treat accordingly, you're not going to get in trouble. Nothing bad's going to happen to you. Woohoo! Why are we so scared of this? Why are we so bothered by this? Like, I'm okay writing a frequent flyer because that's a simple report. That's an easy ride. And guess what? You can turn and burn it. Throw them in the truck, grab some signatures, take some vitals, make sure you're doing everything right, drop them off at the hospital, get back in service, and go. It's not that complicated. It's really not. So, This one's short, but this is something I think that we need to talk about a little more often and have honest conversation about. So if you learned something, cool, share it with your friends. If not, if you were offended, cool, put a helmet on. I'll see you guys next time. Bye bye.